HIV infections are declining in India. In fact, according to the latest UN report, India figures among countries which saw some of the most significant reductions in HIV infections, even amidst COVID-19 and other crises. Though 40 years into the HIV and AIDS epidemic, myths and misconceptions are still so widespread. To raise awareness of AIDS and the spread of HIV, World AIDS Day is observed on 1st December every year globally since the last 33 years. The theme this year is Equalize, which emphasizes eliminating the inequalities that have slowed the fight against the disease. Joining us today on the Banega Swasth India campaign special show, Mr. David Bridger, UNAIDS Country Director, India, Dr. JVR Prasada Rao, former Union Health Secretary, Government of India and former UN Secretary General's Special Envoy on AIDS in Asia Pacific, Dr. Tanya Narendra, MBBS, MSc, FRSPH, popularly known as Dr. Cuterus, Mr. Ravi Bhatnagar, Director, External Affairs and Partnerships, SOA Reckitt, and Mola Balani, living with HIV since 23 years, and she's been working with the India HIV/AIDS Alliance. Thank you all so much for joining us today. I would like to start with you first here, David. The theme this year for World AIDS Day is Equalize. Why do you think this theme is important, and specifically for India, how relevant is it?
Look, it's a critical theme, and I think it's important because when we look at new HIV infections and AIDS-related deaths, we really see that they lay on a fault line of inequality. Inequality is driving those new infections and contributing to those new HIV/AIDS-related deaths as well. So the theme Equalize is really a call to action. It's a call to action for us to really look at ways in which we can increase access to services.
Yes.
So those services from prevention, testing, treatment and care are more equal and accessible to all. It's also a call to action for us to look at laws and policies that may be getting in the way of our response to HIV.
Absolutely. Dr. Rao, you have played an instrumental role in implementing a comprehensive and decentralized national AIDS program. You headed NACO to Secretary General. What is the transition you see personally in the last 20 years?
I think when I joined NACO, I think the epidemic was at its peak almost. We were having a huge number of new infections, and there were no treatment at the time available. So people were dying in large numbers. And the type of political support that is needed for the program was not forthcoming at the time. The country was still living in a denial phase. From there, in the last 20 years, I think we have brought it to a stage where I think India can be proud of having one of the most comprehensive and most successful AIDS control programs in the world. Because we have not only controlled the new infections, the rise in the new infections, but also tried to bring it down by substantial number in the first decade, that is from 2000 to 2010, but maybe at a slower pace in the second decade also, from 2010 to 2020. So there is a complete change in the course of the epidemic.
Dr. Tanya, you run a sexual and reproductive health channel on Instagram. You also create content around women's health. Do you think somewhere women are lacking in taking their decisions? Do you think women are more vulnerable? Are they in a position to actually negotiate safe sex? Can they ever say no?
There is a lot of things that do go wrong when women make the choice, unfortunately. We're still progressing forward. We're still going ahead in terms of women having any autonomy at all over their bodies, over their lives. So realistically, there's certain stratas of society where absolutely women are able to make the choice and they're pushing forward. And hopefully I see it happening in other stratas of society soon too, with more education and more communication about these issues.
Ravi, I would like to ask, how important is it to spread awareness to the youth?
This is one of the very important days which reminds us of our responsibility of leaving no one behind. I really think youth are the foundation, and India is one of the countries which has the highest young population group. So until we invest in the youth, the results will be very inferior in the future. It's important we invest now so that we have the social return on investment in terms of decline in the new infections, in terms of decline in the STI prevalence rates, in terms of the nudges what we will be using. It's very important, how the behavioral change programming is done, which is culturally adaptive. Because India is not just India. India has a subset, or we can say it's Bharat and India both. So as much as those who are exposed to social media and media, they get the information, especially youth.
Yeah.
It's very important also to cater to the media dark areas.
Absolutely.
Which Bharat may have. And with the whole India moving to the 5G and other things in terms of technology, it's important how we bind everything together. Successfully, NDTV and Detol, we have been working with the India's largest and the longest health campaign.
Yes.
With season 9, which we concluded on 2nd of October. We raised a lot of questions. We did a lot of Jan Andolans. We made sure everyone is a part of that. Youth is a central focus point.
Yes.
It's very important. We drive the change with the youth, for the youth, into the youth. And for that, I urge everyone, including the UN agencies, to come together and we reduce the inequalities and we bring equity.
Today we have with us Mona. Thank you so much for joining us. You're an inspiration for so many. In fact, you've been living with HIV for 23 years. Tell us, Mona, what change do you see in the last 23 years, whether it's from the stigma then to treatment and access?
Yes, Ambika, there are a lot of changes because when I diagnosed in 90s, so that time the HIV was not well known. The known factor was AIDS, AIDS equal to death. So that was the statement very popularized in general community as well as healthcare providers. So if we say now the terminology and the friendship with the HIV become and adapt by the public in general. So now the people knows what is HIV, how it spreads, how it doesn't spreads, and how we can avoid the situation of AIDS. So there are certainly a lot of change through the information, education, communication materials, and through the NSCP programs which initiated since NSCP 1. So I think there is a lot of change in terms of awareness, in terms of health services, in terms of expansion of the treatment centers, in terms of community friendly services. But still, there are a lot of things, gaps which needs to filled up by the community ownership.
So a lot has happened, but still those gaps need to be filled in. I think that's a very important point, and I think we together need to do this. David, nationally, like we've been talking about, the figure is 24 lakh people are estimated to be living with HIV, but 19 lakh people living with HIV know their status. Similarly, about 16 lakh people in our country living with HIV are on, the antiretroviral treatment. How do you think we can bridge this gap on about testing and treatment?
Sure. Look, I think as you've just outlined, there are clearly still gaps in the response, and Mona has alluded to those as well. But let's also just pause to also acknowledge some tremendous progress here in India. And and it's the only time I'll talk about statistics, so I won't go on and on and on.
It's good to see what good has happened, I think, the positive.
I mean, if we look back over the last 10 years, India has made some tremendous progress. I mean, it has reduced new infections by 50%, and it has reduced AIDS-related deaths by nearly 80%. Now, this is a tremendous shift forward. Our goal, however, is to achieve 90% reduction in new infections and 90% reductions in AIDS-related deaths. So there are still clearly gaps in the response, gaps that we need to address and gaps that need to be fine-tuned.
Yeah. Dr. Rao, if I could come to you here, throughout your career, you have consistently advocated for the empowerment of the vulnerable communities. The key population groups that are particularly vulnerable to HIV frequently lack adequate access to services. How can we break away from this and ensure that no one is left behind? We have been talking about how important it is, and also it's one of the SDG goals.
See, that was the main challenge in the case of HIV, because right from the beginning, we have seen it is these populations whom we call key populations now, the vulnerable populations, they bear the brunt of the epidemic. And the latest estimates of UNAIDS last year has shown that not only in India, but in the entire Asia-Pacific region, 95% of the new infections are occurring among these key populations. That means sex workers and their clients, gay men, transgender population, injecting drug users, prisoners, people who are at the bottom rung of the economic and social ladder. So unless we really target them with programs for prevention and also bring them for testing and treatment. And most importantly, look at the legal environment surrounding them so that, how can we decriminalize those behaviors so that they can be like any other citizen, accessing all the benefits of that society and governments are giving. So that is the real challenge. So legal reforms, to my mind, I think is very, very important.
David, we've been talking about, you've been telling us how we could improvise. But if I ask you about the SDG goals, Ravi spoke about it, we've been talking. How do you think we can achieve it? And why is it so important now, specifically because COVID has even made the situation or slowed down the process? Let me put it that way.
Yep, sure. So look, just to take a step backwards and to explain what the SDGs are. I mean, back in 2015, member states of the UN, so countries, came together, including India, to look at a 2030 agenda for sustainable development. And in that agenda are 17 goals that will enable us to jointly, as a globe, as member nations of this planet, achieve a certain amount of progress and development. Now, in those 17 sustainable development goals, which we call the SDGs,
yes,
there's one that addresses health, and in the health goal, there is an ambition to end AIDS as a public health threat by 2030. And again, that is about reducing new infections and reducing AIDS-related deaths. It's an ambitious goal, but it's a goal I'm confident that we can achieve.
Absolutely. So on that note, we're going to be taking a really short break. We'll be right back. Welcome back. You're watching a special on the World AIDS Day. We have with us very eminent panelists. Ravi, I would like to ask you, Reckitt, Birds and Bees program is reaching out to 4 million youth and adolescents in Northeast India. But unfortunately, the HIV prevalence rates in the northeastern states of our country are very high. In fact, Mizoram is 10 times higher than that of the national average. What are you all doing differently in the state of Mizoram?
When we started the Durex Birds and the Beestock program in Northeast, I remember there was a huge online, representation by various groups which started discussing about Stop CSC, which is Stop Continuous Sex Education. We took a different route. We involved the parents, we involved the teachers. We made sure the whole curriculum which we worked with the Vitika from Love Matters. Yeah. So when we created the curriculum, we made sure parents are a big part and parcel to that. Yeah. It's not just a company making a curriculum and taking it forward to the children or to the young adults. There is a very interesting way of doing the ethnographic research. By the virtue of that, actually the ethnographers stayed there in the northeastern states before actually putting the content together. Yeah. Although there were a lot of efforts by Government of India, by NACO and by respective state AIDS control societies, yes, to bring youth-oriented programs. We have, in India, we have two systems in the society. One is Daya Bhaga and second is Mitaksha, women-headed households. Yes. We have seen actually women coming forward and actually, educating their sons too.
Because that's really important.
It's not just women teaching women or peer learning where, it's not just a women-centric program.
Yeah, it's important to take it forward.
This is a program where everyone is a part of that. Now, the next step is going to the areas like Tawang and others where, for 6 months, 5 months, they're all under ice and under snow.
Yeah, so how
you reach out there?
Yeah.
We're working with the drones. Drones to carry the icy material to the last mile because your helicopters, your choppers will not fly because of the climatic condition. Also, there are trials which are going on even to transport the ARVs and the TB drugs to those places where you can't go very easily. We are not alone into this as Reckitt or as Durex as a brand, but we have a lot of support which we get from the central government with the agencies. And to put on record, Winnie has been supporting this whole campaign on the World AIDS Day from almost 5 seasons.
Yeah. Dr. Tanya, there are around 24 lakh people estimated to be living with HIV in India in 2021. Around 63,000 new HIV infections continue to be estimated annually as of 2021. which means that over 6 lakh new HIV infections occurred cumulatively over the last 10 years, which could have been prevented. Most of the infections are happening due to unsafe sex practices. What do you think? Is it that the use of condoms are low? Is condom usage or talking about condoms still a taboo?
Absolutely. I feel like there is unfortunately a lot of resistance to condom use because of a couple of different reasons. And unfortunately, people are not educated in how condoms should be used correctly, because if condoms are used correctly, there's like a 98% chance of, not getting pregnant and of course reducing your STIs. With using condoms, you cut down your risk of having STIs, but unfortunately we don't really know how to use them. So often people won't put it on correctly. So often people put it on just before penetration when, genital contact has already happened. So the fluids have already been exchanged, so to speak, which is why even when there is use, it's not perfect use, which, creates a lot of problems.
Mona, how important is it to address the stigma as well as strengthen the community support system? We've spoken about what all should be done. What are your thoughts on this?
See, when we talk about the stigma, so if a person living with HIV, there is a big fear due to the self-stigma.
Yeah.
So the self-acceptance is must. So if anyone newly diagnosed with HIV, how they get the self-acceptance? When they will feel enabling environment in family, friends and surroundings. So that environment building where we need to contribute being a community. And while I am saying community, it doesn't mean only PLHIV community as a whole, which includes all the society support.
Yeah.
From the birthplace of the family to the institution, accommodation and the occupational places. So I think it's a vast range to have the allies at every level to address the stigma as well as to respond that. So that integration is making a big place to address that stigma.
So integration is must. Dr. Roy, if I can just ask you, something we've been talking about, what could be done, but since you've been so long in the system, do you think we have enough finances for the AIDS program in our country?
I'm not really worried about the finances part, because the latest National AIDS Control Program Phase 5, I think it has committed 15,000 crores for 5 years. So funds, I don't think will be a problem in India. It's a question of how you use those funds. In the last 10 years, an entire new generation of young people, aged between 10 and 18, are born without any knowledge of AIDS, without any knowledge of HIV. I think that is a huge risk factor in our country which we are carrying. So I think, so far as I am concerned, money is not a problem, but things are not happening to the desired extent. You mentioned about the SDG. We have put very lofty targets for 2025 and also 2030. We are falling behind. We are not going to achieve any of them if it is business as usual in this country.
I just want to ask you a question, David, on the mother-child transmission, and reckon in our campaign, we really focus on nutrition as well as mother and child health. David, what are the interventions that can help bring us down? Because it's still in India, if we talk about the pool prevalence, it is as high as 8.76%, which is very high.
Yeah. Look, still, it's a gap in the response.
Yes.
And it's a gap not only in India, it's a gap in a number of countries. The critical point here is that it should no longer be a problem in any country. We really should be eliminating mother-to-child transmission. In an exciting development in partnership with the National AIDS Control Organisation last week, an alliance has been formed nationally under the lead of NACO, but with UNAIDS, with UNICEF, with WHO, and a number of other partners in country to see what we can actually do to accelerate action on this particular area. Yeah. I mean, there's so much more that needs to be done in terms of prevention, preventing new infections, and ensuring that we take mothers, pregnant women, through a range of services, ensuring that they are tested early. So a whole range of interventions, really looking at testing and linking people to treatment.
Before we wrap up, Dr. Tare, I would like to ask you, there are so many myths, misconceptions, regarding HIV and AIDS. Can you help bust some of those for us?
there are more and more cases of people being cured of AIDS now. More and more scientific revolutions are happening. So it's not a death sentence anymore. That's the first thing I want to start with. There are ways to manage it. There are ways to ensure good quality of life. There are ways to, stay healthy and alive for a long, long time, even if you have been diagnosed with HIV. The second thing is HIV does not mean AIDS. This is a very important difference, and we all kind of get confused. Usko AIDS lag gaya hai, and what you catch is HIV. So HIV is the virus which leads to, over a long time, it can lead to the condition of AIDS. We can think of it like coronavirus is the virus, and the disease it causes is COVID. Of course, once you catch coronavirus, you get COVID sort of immediately after. That's not the same with HIV and AIDS. It takes a very long time for it to develop, and there are multiple medications that can stop or prevent the conversion of HIV into AIDS.
Thank you so much, David, Ravi, Dr. Rao, Dr. Tanya and Mona for joining us on this very, very critical issue, HIV, which was once an unimaginable chronic health condition, but now with advances in prevention, diagnosis, management and care, people with HIV can live long and healthy lives. The COVID-19 pandemic has certainly pushed back some of the efforts and progress that has been made towards eradicating HIV. There is an even more urgent need now to double those efforts. A core principle of the 17 Sustainable Development Goals and of the AIDS response is that no one should be left behind. This AIDS Day, let's pledge to equalize, address gender and human rights barriers and end all inequalities, ensuring a healthy India and our mission of Lakshya Sampurna Swastika. Thank you all so much for watching.